Let me ask you something. Do you experience back pain? Well, if you do, you're not alone. 60% of adults report experiencing back pain in their lifetime. But there's good news. Back pain is usually temporary. It's not that your back is ruined when it starts screaming at you. It's just that it's grumpy. In this video, we'll present to you tools to help you manage your back pain. And with a little know-how, you should be able to decrease the severity and frequency of your back pain episodes. Common triggers of back pain are sitting in one position for too long, getting out of bed, driving, etc. Some would say that back pain is caused by a weak back and that there's something wrong with your back. But that's usually not the case. The most likely explanation is that your back is letting you know, in its own painful little way, that it wants you to move more. Specifically, it wants you to move it more. To prove my point, episodic back pain improves within a month in most patients. The key here is to move your back and to use your body as much as you can tolerate. Yep, that's what I said. Movement is key. And guess what? Bed rest is the worst. It's been shown that movement helps to speed up recovery times when dealing with back pain, and that returning to work as soon as possible is one of the best things you can do for your back. So now that you know that you should move, let's talk about how to move. For those of you whose backs are bothered by sitting, like in the car or at the office, I have good news for you. You know, slouching is not a crime. But what is a crime is slouching all of the time. Get in the habit of moving your back and body around regularly. Twist this way and that. Bend, forward, backward, side to side. Roll your shoulders. Stand up. Move around. You might ask yourself, how often? To that I tell you, frequently. This could be 2 or 3 times an hour. You might say, geez, I'll never remember to do that. Well, not to worry, just set yourself a reminder. You can put up some sticky notes or set a timer, anything. Just move. Keep in mind that flexing, bending, and twisting is great for almost everybody, and it can be done anywhere. For example, say you're a person who suffers from an achy back in the morning when you get out of bed. These following exercises can be done even before your feet touch the ground. So up to this point, we've learned that movement is key and that inactivity is the worst. With that in mind, the American College of Sports Medicine recommends 150 minutes of mild to moderate activity per week for general health. So that works out to 2.5 hours a week, just 25 minutes a day of walking, biking, swimming, gardening, doing chores. All of these work to strengthen your legs, arms, lungs, and, wait for it, yes, your back. Some other areas of wellness include stress relief, sleep, diet, and weight loss. So pay attention to those areas for back pain relief also. Those are some general recommendations for your back health, but still, there are times when you're going to want to seek out your primary care physician or physical therapist. Symptoms warranting an appointment may be things like pain shooting down your leg, severe pain after an accident or fall, unexplained weight loss, or neck pain after hitting your head. Although uncommon, situations like these just mentioned could pose significant health risks, so please schedule an appointment to rule out any major problems. So that's it. Now you have some tools to help manage your back pain. Just remember, it's all about the movement.